The summer of 2008, Tom Burton and I founded Catalyst. He and I worked together at Intermountain Healthcare. I had responsibility for the data warehouse and analytical services there. He had responsibility for their financial systems and working with some of the clinical teams. We worked very well together. We saw a need in the market.
Our first client was Allina Healthcare in Minneapolis, and we started with them building an enterprise data warehouse and working with their clinical teams to use that enterprise data warehouse to improve care.
Allina Health Systems was able to extract $10.46 million in savings over a 3-year period by simply looking at the waste in nurse resources and extracting that waste from the process.
We have a real clinical focus and a lot of clinical depth. And so when we engage with a customer, with a health system, we bring clinicians to bear. We're not just dropping the software off at your doorstep and now it's up to you. We understand that fundamentally, if we're going to see the change occur that we need to, it's up to clinicians. And so we bring clinicians on our staff to make sure that our health system clinicians are getting the support that they need.
The founders of Catalyst have deciphered the way to build a world-class data warehouse solution that doesn't take 3 or 4 years, but takes 3 or 4 months to deliver real value for our clients. And when that gets delivered, incredible insight is found inside of the operations of these organizations, leading caregivers to be able to provide higher quality, lower cost care. It's as simple as that.
We are totally focused on making sure that we are building in clinical content into our databases that really help teams understand what's happening.
I was talking to one of the doctors at one of our clients, and I asked her for feedback on her experience with Catalyst, and she told me, basically in her own words, she said that they were a data-intensive group, but they've always been frustrated with the inability to get the data they needed to be able to improve care. And she said for the first time with Catalyst, they actually found somebody who A, gave them access to the data, but much more important, gave them the ability to interpret the data the way they wanted to so that they could improve care. They said that Catalyst was able to talk both IT talk and physician talk, and that made it unique from any other vendor that she had experienced before because they were able to help guide them through the questions that they had and even anticipate questions that they didn't have.
So when I first came to Health Catalyst, the most interesting thing to me was how quickly customers are tripling and quadrupling their investment with the company. I asked myself, why is this? This is not the traditional vendor-client relationship in healthcare technology. Clearly, this company is delivering tremendous value early and frequently that is highly visible to our customer partners.
Our mission is to really help our clients improve care by reducing waste, improving the quality of care, and improving the satisfaction of their patients.
The founders of this company are much more interested in building a world-class data warehouse tool that can be used by caregivers than they are in building a business. This is all about really very much a mission-based company that seeks to drive the right solution in the industry. And as a result, the business will follow.
And so there's great opportunity, and I'm very optimistic. I came out of retirement because I believe we can have 1,000 points of light that prove that this can work not just at Intermountain Healthcare or the Mayo Clinic or somewhere else, but it can work in a hospital as small as a single hospital or a 2-hospital system. It can work in an academic medical center. It can work in a specialty children's hospital. We've proved that with our clients.
I really do believe that we can enable healthcare to deliver better quality care, faster translational research, and lower cost at the perfect time when the country needs it most.
I'm really excited about the future of Catalyst, and we have a lot of new products that we've been developing. We really hope that as we get more and more clients, that they will become examples of how to improve care, how to use data, and how to eliminate waste in the U.S. healthcare system. We really feel that those that apply our methodology, use our software, have the best chance of doing that in the country.